Hi, I'm Dr. Marcia Sirota, and today I want to talk about this unfortunate tendency that people have lately to diagnose themselves with some type of mental health disorder. You know, it takes a long time to become a mental health professional, and you have to go through a lot of training and have a lot of experience in order to be permitted to offer a mental health diagnosis. It's not something that should be taken lightly at all, because although it's very helpful to understand what our mental health condition might be, it's also quite dangerous to be mislabeled with a condition that we don't have. So here we are in our social media era, and all of these influencers, these so-called influencers, are talking about their quote-unquote mental health diagnoses. But do they actually have a mental health diagnosis? Who has given them this diagnosis? Was it a mental health professional? Or did they look at a YouTube video and go, oh, I must have autism spectrum disorder, or I must have attention deficit hyperactivity disorder? You know, it's one thing to go to a specific trained, experienced mental health professional and get a formal diagnosis based on a real and valid assessment. It's another thing altogether to look at a YouTube video or a TikTok and decide that you have a mental health condition based on that. That is not a proper diagnosis. Then that doesn't mean anything, you know, it's not legitimate. So we have to be really, really careful when someone comes to you and says, oh yes, I have this condition, I have that condition, I have post-traumatic stress disorder, I have attention deficit disorder, I have autism spectrum disorder. Well, maybe they do and maybe they don't. You know, it's very highly regulated who is allowed to give a diagnosis. And, you know, there are a lot of even mental health practitioners who are not allowed to give a diagnosis because they don't have adequate training and they are not permitted. So they can give psychotherapy, for example, but they're not allowed to diagnose a mental health condition. It's really a privilege to be able to give a mental health diagnosis because the person on the receiving end is really trusting the professional to know what they're talking about and to see into them and to understand what they're going through and to provide something that's accurate and helpful. And the problem in non-medical or non-therapeutic fields is that they don't have that motto of first do no harm. First do no harm is part of the American Psychological Association and the American Medical Association, as well as Canadian associations. It's a part of their value system. Everything is based on that. We do not want to do harm. And so we don't do things that we know might cause harm. So, for example, diagnosing someone without the proper credentials, without the proper qualifications, is inappropriate. The same goes for treating. So even if you're a medical doctor, you're not supposed to treat outside of the area of your expertise. So I am not, as a psychiatrist, qualified to do neurosurgery. So if I went in and started doing neurosurgery, I would be committing malpractice. I would be beyond the scope of my expertise, and that is not appropriate. And also, I'm not supposed to be diagnosing people with conditions that I'm not trained for. So, you know, there might be things that are very particular to another discipline that I would not know. You know, as a doctor, there's a lot that I do know, but there's also limits to my knowledge because I am not a specialist in every field. So non-medical people are even less qualified. You know, people who are not trained as psychologists, people who are not trained to give proper diagnoses can cause actual harm by mislabeling people with inappropriate diagnoses, and then this person might go seek treatment for a condition they don't actually have, or they might walk around with this label for the rest of their lives thinking one thing about themselves when it's completely false. So we have to be very careful when we're looking at influencers online diagnosing themselves or diagnosing others, because giving a diagnosis is only supposed to happen if you actually know how to do it. And it's a small group of people who are qualified, and even they would not be diagnosing themselves necessarily online or diagnosing strangers online. That's not really appropriate, because to diagnose someone, you have to have actually assessed them in person or at least online. And then once you have assessed someone, it's a boundary violation to announce their diagnosis in public. So you wouldn't do that. That is not professional, right? Even if I did have an assessment with someone, I would not then post my diagnosis for everyone to know, because that would not be a professional thing to do. That would not be appropriate. That would not be ethical. So we're not supposed to diagnose strangers. We're not supposed to broadcast our diagnoses of our patients online or our clients online, and people are not supposed to diagnose one another without their qualifications. So beware of diagnoses given, casually, randomly by unprofessional, unqualified individuals. It really can cause harm. Sometimes an influencer might say, oh yeah, I have X diagnosis. Well, maybe they do and maybe they don't. We don't know where they got it. And then their followers will say, oh, I think I have that diagnosis too. They gave 3 symptoms and I have them all. Well, a lot of conditions have a bunch of specific symptoms and a whole bunch of non-specific symptoms, we call them. And non-specific symptoms, basically anyone can have them. It's like in medicine, sweating, feeling tired, having aches. Those are non-specific symptoms. They could mean nothing and they can mean something serious. So in mental health, being nervous, having problems with sleep, having difficulties with your appetite, all of these things are non-specific. They might mean something, they might mean nothing. Being distractible, that can be part of any number of conditions. It can also just be part of being a normal human being in a very, distractible era. So we have to be really careful when we are looking at someone else telling us about their diagnosis and their non-specific symptoms, because these non-specific symptoms that we might share may mean absolutely nothing, or they may be part of a completely different diagnosis. And so here we are diagnosing ourselves with X, and we might actually have Y. And if we're seeking treatment for X, we're not getting the proper treatment for Y that we actually do have. So, take all of the things you see about mental health and mental health diagnoses by untrained people online with a large block of salt, more than a grain of salt, because, if you're not qualified, you don't really know what you're talking about. I've been a psychiatrist for many years. I've been a doctor for many years, and I can tell you that it took me a lot of effort and a lot of work to get to where I am today, and a lot of studying and a lot of practice to be able to offer a diagnosis. And I see that even when I offer my best diagnosis, that another colleague might disagree with me. It's partly science and it's partly an art.